Today, we're focusing on hematoma prevention and management, a critical topic for your phlebotomy exam. The exam will test your ability to not only identify the causes of a hematoma, but to react instantly and correctly when one forms. A common exam question will present a scenario where a patient's arm begins to swell at the venipuncture site. Your first and most important action is to immediately stop the draw. This means releasing the tourniquet, removing the needle, and then applying firm pressure. The test will try to trick you with options like adjust the needle or finish the draw quickly. These are always wrong and put the patient at risk. The key is to prioritize stopping the leakage of blood into the surrounding tissue. Let's break down the most common causes, as these are frequently turned into exam questions. A primary cause is improper needle placement. This includes transfixing the vein, which means the needle enters the top of the vein and exits through the bottom, or having the bevel only partially inserted, which allows blood to leak out. Another major cause and a classic exam trap involves the tourniquet. You must always release the tourniquet before you withdraw the needle. Leaving it on creates venous pressure that forces blood out of the puncture site into the tissue, creating a hematoma. The exam might ask which action is most likely to cause a hematoma, and forgetting to release the tourniquet is a top answer. Using a needle gauge that is too large for a small or fragile vein is another preventable cause you'll be tested on. When a hematoma does occur, your response must be systematic. To help you remember the immediate steps, use the mnemonic STOP. First, stop the draw by releasing the tourniquet and removing the needle. Then, talk to the patient, reassuring them while you act. Next, Oppress by applying firm, direct pressure to the site with gauze for at least 2 to 5 minutes. Do not have the patient bend their arm, as this can increase pressure and worsen the hematoma. Finally, pack with cold by applying a cold compress to the area to reduce swelling and pain. Documenting the incident is the final, critical step. The exam may include questions on professional responsibilities, and documenting what happened and the interventions you performed is a key part of patient safety and care. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.